Screaming monitors echoed through the chaotic ER as a young soldier's heart completely stopped. Paralyzed by fear, the chief surgeon froze, his scalpel trembling. Suddenly, the quiet, overnight janitor let his mop clatter to the floor, snapped on sterile gloves, and shoved the doctor aside. "Step back. I've got this." The emergency room at St. Jude's Memorial Hospital in downtown Chicago smelled perpetually of iodine, stale coffee, and quiet desperation. To Clara Hayes, a trauma nurse who had spent the last 6 years running on adrenaline and 4 hours of sleep a night, it was a second home. Clara knew the rhythm of the ER better than the beat of her own heart. She knew which doctors panicked when a trauma bay filled with blood, which residents needed their hands held, and which patients were lying about their pain levels. She also knew that the hospital janitor, River, was hiding something. River, or Artie, as the daytime receptionists called him when they bothered to acknowledge his existence, was a fixture of the night shift. He was a tall man, though he carried himself with a permanent stoop that made him seem smaller, trying to fold himself into the background. His graying hair was always neatly clipped, his uniform an immaculate faded blue. He spoke in a low, gravelly rasp, mostly just "excuse me" or "watch the wet floor." To the arrogant surgeons and the frantic medical students, Artie was part of the furniture, no more consequential than the IV poles or the biohazard bins he diligently emptied. But Clara had watched him. In the high-stakes environment of trauma medicine, observation was survival, and Clara noticed the inconsistencies in the quiet janitor. It started 3 months ago during a grueling double shift. A teenager had been wheeled in, struggling to breathe after a severe asthma attack. The overworked resident, exhausted and flustered, was preparing to administer a standard dose of epinephrine. Artie had been mopping near the curtain. As he wrung out the mop, he muttered, barely above a whisper, "Check the fingernails." Clubbing. "It's not asthma. It's undiagnosed cystic fibrosis. Epi will send him into an arrhythmia." Another arrhythmia. Clara had spun around, but Artie was already pushing his yellow bucket down the hall. Heart-pounding, Clara had stalled the resident, checked the boy's hands, and demanded a different course of treatment. She had saved the boy's life that night. When she tried to confront Artie later, he merely stared at her with hollow, storm-weary eyes and told her she must have been hearing things due to fatigue. It wasn't just what he said, it was how he moved. When the trauma alarms blared and chaos erupted in the bays, civilians and non-medical staff instinctively flinched or stepped backward. Artie didn't. He stepped into the most optimal corner of the room, completely out of the way of the crash carts, but with a perfect, unobstructed view of the patient's vitals. His hands, gripping the handle of a mop or a trash bag, never trembled. They were large, heavily scarred, and possessed a quiet, terrifying steadiness. Tonight, the ER was a madhouse. A sudden ice storm had turned the interstate into a demolition derby. Clara wiped a streak of sweat from her forehead with the back of her forearm, checking the inventory of the crash cart in Trauma Bay 1. "Hayes, I need 2 units of O-negative. Start," yelled Dr. Richard Sterling, a brilliant but notoriously high-strung attending physician who treated the nursing staff like indentured servants. He was currently struggling to stabilize a middle-aged woman with a ruptured spleen. "Already hanging, doctor," Clara replied crisply, tapping the IV line. "Her pressure is stabilizing, 90/60. Sterling grunted, unable to find a reason to criticize her. "Fine, close her up enough for transport. Get her to the OR." As the gurney was wheeled away, Clara leaned against the counter, closing her eyes for a fraction of a second. The squeak of rubber soles against wet linoleum made her open them. Artie was there, silently wiping up the trail of blood the gurney had left behind. "Busy night, River," Clara said, her voice softer than it had been with the surgeon. Artie didn't look up. His movements were rhythmic, almost hypnotic. "Ice makes people forget how to drive, Miss Hayes. Nature's way of reminding us we aren't in control." "Where did you learn about cystic fibrosis?" she asked. It was a bold move, bringing it up again. She hadn't pushed him in weeks. Artie paused. The mop stopped moving. For a second, the stooped, invisible janitor seemed to vanish, replaced by a man of rigid military posture. The shift was so instantaneous and intense that Clara felt a chill run down her spine. Then, just as quickly, his shoulders slumped. "I read a lot," Artie rasped. "Hospital library throws out old medical journals. I fish them out of the recycling. You diagnosed a complex genetic disorder from a glance at a patient's fingernails because you read discarded magazines?" Clara asked, crossing her arms. "I have a good memory." Artie finally looked up, his storm grey eyes meeting hers. There was a profound, suffocating sadness in them, an ocean of grief that Clara couldn't even begin to fathom. "You should check the suction canisters in Bay 2, Miss Hayes. The regulator is jammed. If you get a chest trauma, it won't pull enough negative pressure." Before Clara could respond, he turned and vanished into the sterile supply corridor. Clara immediately walked over to Bay 2, tested the wall suction, and frowned. It was completely jammed. She swapped it out with a fresh regulator just as the overhead speakers cracked to life with the sound that made every ER worker's blood run cold. Code blue, incoming trauma. ETA 2 minutes. Code blue, incoming trauma. The ambulance bay doors blew open with a violent crash, bringing a gust of freezing wind and the chaotic shouts of paramedics into the suffocating heat of the hospital. "What do we have, Doctor?" Sterling barked, already pulling on a fresh pair of gloves, his face pale under the harsh fluorescent lights. Clara was right beside him, a pair of trauma shears ready in her hand. 26-year-old male, motorcycle versus concrete barrier. The lead paramedic yelled, sprinting alongside the gurney as they rushed it into Trauma Bay 2. He was thrown 30 feet, wearing a helmet, but his chest took the brunt of the impact against the handlebars. BP is dropping fast, currently 70/40. Heart rate is 145 in Trudy. He's fading. Clara and the rest of the team grabbed the edges of the patient's backboard. On 3, 1, 2, 3. They heaved the broken body onto the hospital bed. As Clara cut away the heavy winter jacket and the torn shirt beneath, a pair of silver dog tags clattered against the metal bedrail. The patient was young, with a buzz cut and a strong jaw, though his face was currently pale and bruised. "He's military," Clara noted, reading the tags. "Sergeant Thomas Ridge." "I don't care if he's the Pope," Sterling snapped. "Get a chest x-ray in here now." "Start 2 large-bore IVs, push fluids wide open. Give me a fast exam." Clara moved with practiced efficiency, inserting the IVs while the resident wheeled in the portable ultrasound machine. The room was a whirlwind of shouted orders, beeping monitors, and the metallic clatter of instruments. In the far corner of the room, trapped by the sudden influx of the trauma team, stood Artie. He had his back pressed against the wall, his hands gripping his mop handle so tightly his knuckles were white. He squeezed his eyes shut, his breathing growing shallow. The smell of fresh, metallic blood, the sound of tearing clothes, the dog tags clinking against the rail. It was a sensory assault. "Not here. You're not in Kandahar. You're in Chicago. You're just a janitor," Artie told himself, a desperate mantra he had repeated for 5 years. "You don't hold a knife anymore. You don't make the call." "Ultrasound is showing a massive pericardial effusion," the resident yelled, his voice cracking with panic. "There's fluid surrounding the heart. It's squeezing it. Cardiac tamponade." Dr. Sterling's eyes widened. The arrogance that usually shielded him was rapidly cracking. "His blood pressure is tanking. 50/30. Prepare for a pericardiocentesis. I need a needle to drain the fluid around the heart." "No." Torres slammed the tray onto the Mayo stand, holding up the long spinal needle. Sterling snatched it. His hands were shaking. He aimed the needle just below the young soldier's sternum, trying to guide it into the sac surrounding the heart to draw out the blood that was crushing the organ. He pushed the needle in, drew back on the syringe. "Nothing. I'm not getting anything." The blood is already clotted, Sterling shouted, pulling the needle out. Sweat poured down his face. He's bleeding too fast into the chest cavity. The tamponade is severe. Suddenly the rapid, high-pitched beeping of the heart monitor shifted into a long, continuous tone. He's coding pulseless electrical activity. Clara yelled, immediately jumping onto the step stool next to the bed and interlocking her fingers over the soldier's chest, beginning hard, punishing chest compressions. Ribs cracked under her weight, but she didn't stop. Starting CPR. Push 1 milligram of epinephrine, Sterling ordered, his voice high-pitched and frantic. He looked at the massive bruising across the young soldier's chest. We have to open his chest. We need a thoracotomy to relieve the pressure and find the bleed. Now, Then do it. Clara grunted, sweat stinging her eyes as she pumped the young man's chest. Sterling, cut him open. Sterling grabbed the 10-blade scalpel from the tray. He looked down at the bruised, bloodied chest of Sergeant Thomas Ridge. He looked at the flatlining monitor. He looked at the scalpel in his trembling hand. He froze. It was a phenomenon Clara had seen a few times in her career, but never from a senior attending. The sheer, terrifying weight of a life-or-death surgical decision had paralyzed him. If he cut and couldn't find the bleeder, the kid died. If he didn't cut, the kid died. The psychological pressure snapped him. Sterling. Clara screamed over the flatline alarm. Cut. I can't, Sterling whispered, stepping back, dropping his hands. He's gone. He's bleeding out too fast. We can't save him. Call the time of death. He's 26 years old and his heart stopped 30 seconds ago. Clara roared, still doing compressions. Don't you dare give up on him. Stop compressions, Hayes. That's an order, Sterling said, his voice hollow. Time of death. Clatter. The heavy, wet mop hit the linoleum floor. Everyone in the room, even the panicked resident, flinched at the sound. From the corner of the room, the invisible man stepped forward. Artie didn't walk with a stoop anymore. His shoulders were broad, his spine perfectly straight. The transformation was so absolute, so jarring, that for a split second Clara thought a stranger had walked into the trauma bay. Artie crossed the room in 3 long strides. He grabbed a pair of sterile gloves from the wall dispenser, snapping them onto his massive, scarred hands with a loud crack. What the hell are you doing, Rither? Dr. Sterling snapped, his confusion temporarily overriding his panic. Get out of here. Artie ignored him entirely. He stepped up to the opposite side of the bed from Clara. He didn't look like a janitor anymore. He looked like a god of war stepping onto a battlefield. His gray eyes were cold, calculating, and completely devoid of fear. Keep pumping, Nurse Hayes, Artie commanded. The gravelly rasp was gone, replaced by a voice of pure, unadulterated authority. It was a voice used to giving orders under mortar fire. River, I will have you arrested. Sterling yelled, moving to physically grab the janitor. Artie didn't even look at him. He shot out his left arm, catching the chief of surgery squarely in the chest and shoving him backward with enough force to send Sterling crashing into the supply cabinets. Step back, Artie barked, his voice echoing off the tile walls like a gunshot. I've got this. You've panicked, Doctor. You are currently a liability to this soldier's life. Stand down. Sterling stood completely, utterly speechless, his mouth opening and closing like a fish. Artie turned his attention to the tray. He picked up the discarded 10-blade scalpel. The trembling that had plagued Dr. Doft. Sterling's hand was nowhere to be seen. Artie's hand was like carved marble. Nurse Hayes, on my count, you will cease compressions and step back. Resident, I need a rib spreader, a pair of heavy scissors, and prepare for internal defibrillation. Move your ass, son. The sheer force of his command broke the resident out of his shock. Yes, sir. Clara stared at the man across from her. She didn't know who he was. She didn't know how he knew what to do, but looking into his eyes she knew one thing with absolute certainty. This man was the only chance Sergeant Thomas Ridge had at surviving the night. "Ready, River," Kara said, her voice steady. "It's Dr. Pendleton," Artie said softly, his eyes locking onto the soldier's bruised chest. 1, 2, 3, clear. Clara pulled her hands away. In a blinding flash of surgical precision, Artie brought the scalpel down. He didn't hesitate. He made a massive, sweeping incision across the left side of the soldier's chest, slicing through skin, fat, and muscle with horrifying speed and perfect accuracy. He was performing a clamshell thoracotomy, the most brutal, invasive, and desperate procedure in trauma medicine. Blood welled up immediately, but Artie didn't flinch. "Scissors," he snapped, holding out his hand without looking. The resident slapped the heavy medical shears into his palm. Artie shoved them into the incision, cutting through the thick cartilage of the soldier's ribs with loud, wet crunches that made the medical students in the room gag. "Rib spreader." He tossed the scissors onto the tray, grabbed the heavy metal retractor, shoved it into the gaping wound in the young man's chest, and cranked it open. The ribs spread apart with a sickening crack, exposing the inner thoracic cavity. The heart was completely hidden beneath a massive swollen sac of dark purple blood. "The pericardium." "Scalpel?" Artie demanded calmly. He took a fresh blade, delicately pinched the swollen sac with forceps, and made a swift, tiny nick. Dark, clotted blood erupted from the sac, pouring out into the chest cavity. The pressure was instantly relieved. Beneath the blood, the young soldier's heart, pale and perfectly still, was finally visible. Artie dropped the instruments. He plunged his bare, gloved hands directly into the open chest cavity of the soldier, wrapping his long fingers completely around the human heart. And then the janitor began to squeeze inside the cramped space of Trauma Bay 2. Time ground to an agonizing halt. The only sounds piercing the suffocating silence were the mechanical wheeze of the ventilator and the wet, squelching thud of River's bare, gloved hands pumping a human heart. Clara Hayes stood frozen, struggling to reconcile the stooped janitor she knew with the commanding trauma surgeon tethering Sergeant Thomas Ridge to the living. River's face was an impenetrable mask of concentration. His thumbs pressed the ventricles, his scarred fingers wrapped around the back of the heart, squeezing with a precise rhythmic cadence that forced oxygen-rich blood to the dying soldier's brain. "Epinephrine, another milligram, Miss Hayes," River commanded, not looking up. His voice held a terrifying, chilling calm, the voice of a man who had stared down the Reaper on bloodier battlefields. "Get the internal defibrillator paddles ready. Charge them to 20 joules. Clara jolted back to reality. "Pushing 1 milligram epi," she echoed, slamming the syringe into the IV port. She grabbed the sterile internal paddles, small metal discs applied directly to the bare muscle of the heart, and coated them with saline. Dr. Richard Sterling, plastered against the cabinets where River had shoved him, watched in pale horror. "You're killing him," Sterling stammered, hands shaking uselessly. "You're a janitor. You're going to prison for murder." River ignored the attending physician completely, his storm-grey eyes locked on the dark pool of blood rising in the lower thoracic cavity. "Suction," he barked at the terrified resident. "Clear the surgical field. Find the primary bleeder." He didn't just tamponade. "There's a major structural tear." "Move." The resident shoved the plastic suction wand deep into the chest cavity. The thick blood cleared just enough to reveal the catastrophic hemorrhage. A jagged shard of the soldier's third rib had been driven inward by the crash, slicing a half-inch laceration directly into the right atrium. Every time River squeezed the muscle, a terrifying pulse of dark blood leaked rapidly from the tear. "Got it," River murmured. "Right atrial laceration. I need a needle driver, a 3-nup proline suture, and a pair of DeBakey forceps. Right now." The surgical tech slapped the requested instruments into River's waiting palm without hesitation. What happened next was a breathtaking display of surgical mastery. Operating on a bleeding, sporadically twitching human heart required elite, hyper-focused skill. River didn't pause. Holding the needle driver in his right hand, he kept his left hand deep inside the chest cavity, expertly manipulating the torn, slippery tissue of the atrium to expose the wound. With blinding mechanical speed, he threw the first stitch. He pulled the synthetic blue thread through the slick muscle, anchoring the catastrophic tear. "More suction," River ordered, his tone never rising above an authoritative clip. He threw a second stitch, then a third. His hands moved with terrifying grace, driven by a deep muscle memory forged in environments far more unforgiving than a sterile Chicago hospital. He sutured the mortal wound using only ambient fluorescent light without magnifying surgical loops. "Tie him off," River muttered, rapidly knotting the delicate suture with one hand. He snipped the end. The bleeding stopped instantly. The dark pool of blood ceased its deadly rise. "Laceration repaired. Paddles, Miss Hayes." Clara handed him the defibrillator paddles. River grasped them firmly, placing the metal spoons directly against the bruised muscle of Sergeant Rich's heart. "Charged to 20 joules, Clara confirmed, her own heart hammering. "Clear," River stated. Everyone stepped back. River pressed the buttons. A sharp, violent thwack echoed as electrical current shot directly into the myocardium. The young soldier's chest lurched upward. River dropped the paddles and plunged his hands back into the chest, resuming the manual massage. He stared intensely at the digital monitor overhead. The flak line broke. A jagged, irregular wave spiked sharply across the screen. "We have a rhythm," the resident whispered. "Sinus tachycardia. Rate is 130. "Check for ephemeral pulse," River ordered. Clara pressed her fingers deep into the soldier's groin. Beneath the skin, a steady, undeniable thumping met her touch. "I have a pulse. It's bounding. Blood pressure is rising. 85/50. River, he's back." River did not smile. He slowly withdrew his blood-soaked hands from the chest, leaving the rib spreader in place. He stripped off the gloves, dropping them into the biohazard bin with a wet slap. The intense adrenaline evaporated from his posture. His broad shoulders rounded. The invisible, stooped janitor returned, instantly replacing the god of war. "Package him for immediate transport," River said quietly, his voice regressing to its familiar rasp. "Get him up to the OR. The cardiovascular team needs to wash out the chest cavity and wire his sternum shut. I just bought you some time." The heavy double doors flew open. Dr. David Montgomery, chief of surgery, stormed in, followed closely by 2 hospital security guards. "What in God's name is going on?" Montgomery roared. His eyes darted from the open, bloody chest to the cowering doctor. Sterling, landing squarely on the janitor. "Arrest him," Sterling shrieked, pointing at River. "David, this lunatic pushed me away from my patient and cut into a man's chest. He practiced medicine without a license." Montgomery stared at River, bewildered. "River, did you just perform a clamshell thoracotomy?" River picked up his mop. "There was a spill, Doctor." "Montgomery, I was just cleaning it up. Sergeant Thomas Ridge survived the night. By the time morning sun breached the frosted windows, the young soldier was resting securely in the intensive care unit, his chest neatly wired shut, his heart beating with stubborn defiance. 3 floors up, Clara Hayes sat perfectly still, exhaustion settling deep into her bones. Across the mahogany table sat Dr. David Montgomery, chief of surgery, and Dr. Burr, Samuel Weber, hospital administrator. Pacing frantically near the window was Dr. Richard Sterling, his face flushed with desperate fury. "This is a catastrophic liability," Sterling shouted, slamming his fist down. "We have a janitor performing a clamshell thoracotomy. I demand River be terminated immediately and arrested for practicing medicine without a license." Dr. Weber steepled his fingers, staring at a thick manila folder. "A 26-year-old decorated Army Ranger was bleeding out on your table, Richard. Nurse Hayes's report indicates you froze." You ordered a time of death on a man whose heart had stopped seconds prior. I made a calculated medical judgment." Sterling shot back. "You panicked," Dr. Montgomery interjected coldly. "I saw the sutures on that boy's heart. The Pearlian knots were flawless. It was a textbook repair under extreme duress. You couldn't have pulled off that stitch on your best day." Weber opened the folder. "When HR couldn't find a medical degree for our custodian, I had security run a federal background check using his fingerprints. The results came back an hour ago." He slid a glossy photograph across the table. Clara leaned forward. The man in the photo was undeniably Artie, but entirely different. He stood tall in desert camouflage, radiating fierce confidence. A silver oak leaf pinned to his collar identified his rank. The medical caduceus struck Clara hardest. "River Pendleton is not a janitor," Weber announced. "He is Major River Pendleton, United States Army Medical Corps. Until 5 years ago, he was the lead trauma surgeon at Bagram Airfield in Afghanistan." Sterling stopped pacing. "If he's a decorated military surgeon, why is he mopping our emergency room?" "Because of the ghosts he brought back," Weber answered softly. 5 years ago, his Ford operating base suffered a devastating mortar barrage. Major Pendleton lost half his staff in the blast. For 48 straight hours, he operated in a shattered tent without electricity, relying on flashlights and raw adrenaline. He saved 32 severely wounded soldiers under continuous enemy fire. Clara closed her eyes, picturing the quiet man holding the line against impossible odds. But on the second evening, Weber continued, a medevac chopper was shot down. The pilot was pulled from the wreckage with catastrophic internal hemorrhaging. Major Pendleton had already exhausted the base's supply of O-negative blood. The pilot was his own younger brother, First Lieutenant Michael Pendleton. A suffocating silence fell over the room. Major Pendleton broke every protocol. He established a direct line from his arm to his brother's, bleeding himself to keep Michael alive while attempting to repair a shredded femoral artery. He pumped so much of his own blood that he collapsed into hypovolemic shock. When he regained consciousness, his brother had died. Clara pressed a hand to her mouth. The profound sorrow in Artie's storm gray eyes finally made agonizing sense. He was awarded the Silver Star, Weber concluded. But the trauma broke him. He let his medical certifications expire and vanished. He believed his hands were cursed. He took a job cleaning our hospital because he felt he couldn't save the only life that mattered. Until last night, Dr. Montgomery whispered, when a young soldier with dog tags came in bleeding out. The instinct to protect overrode the trauma. He didn't see a stranger. He saw his brother. Weber glared at Sterling. "You will not speak a word of this. If I hear a whisper about liability, I will personally ensure the medical board reviews your gross negligence. Major Pendleton is a hero. We are protecting him." Clara didn't wait to be dismissed. She stood up, exhaustion banished by pure determination, and practically sprinted down to the hospital's subterranean level. She found him in the cavernous laundry facility. Artie was standing silently by the industrial washing machines, methodically folding sterile green surgical gowns. He looked incredibly small, the heavy and visible burden pressing his shoulders back into that familiar, defeated stoop. They know, don't they? Artie rasped, not turning around. "They know everything, River," Clara said gently, stepping beside him. Artie closed his eyes, his scarred hands trembling against the fabric. "Tell the boy's family it was Dr. Sterling. Tell them I just cleaned the floors. Please, Miss Hayes." "I won't do that," Clara said fiercely, wrapping her hands around his scarred ones to stop his folding. "Sergeant Ridge is awake. His parents just landed from Texas and they are sitting by his bed. He is asking to meet the surgeon who gave him a second chance at life." Artie shook his head, a single tear tracing his weathered face. "I couldn't save him, Clara. I held Michael's heart, and it stopped anyway." "You couldn't save Michael, and I am so profoundly sorry for that," Clara said, her own tears blurring her vision. But you saved Thomas Ridge. You gave another family their son back. Michael wouldn't want you burying your miraculous hands in a basement laundry room. Artie stared at her, the impenetrable wall of grief finally fracturing completely. Dr. Weber is contacting the state medical board to expedite a reinstatement of your license. Kara smiled through her tears. Dr. Montgomery wants you as the new chief of trauma. But right now there is a mother upstairs who wants to hug the man who saved her boy. Artie looked down at his hands that had scrubbed floors, hands that had waged war, hands that had held a beating heart. He took a slow, shuddering breath. As he exhaled, the stoop in his spine vanished. Major River Pendleton stood tall. "Miss Hayes," he said, his voice steady, resonant, and alive. "Take me to my patient. If you were captivated by this incredible story of redemption and heroism, don't forget to hit the like button and share it with someone who needs a reminder that heroes walk among us every single day. Subscribe to the channel for more jaw-dropping real-life medical dramas and untold stories of extraordinary courage. Leave a comment below on what you think Dr. Pendleton should do next.